Whether it is a microneedling session, a laser resurfacing, or a deep chemical peel, modern aesthetic treatments rely on a singular, counterintuitive premise. To achieve healthy, rejuvenated skin, we must first intentionally damage it. This clinical equation establishes that the procedure itself is only the initial trigger. It is an act of controlled injury, designed to put the skin into a temporary wound state. This cross-section shows the immediate physical reality of that injury. The device creates thousands of open microchannels, plunging the tissue into a state of cellular stress and leaving the deeper layers vulnerable to microbial infiltration. Once the clinical device is turned off, the skin begins a high-stakes recovery phase. The procedure provides the initial stimulus, but the subsequent management of this wound state dictates the ultimate precision of the remodeling process. The second half of the equation reveals that the final aesthetic outcome depends on how the disrupted skin barrier is managed in the hours and days following the treatment. Many traditional post-treatment protocols fail here. They often involve applying harsh antiseptics like alcohol or iodine directly into those newly formed open microchannels. This creates a significant risk of cytotoxicity. These chemicals are indiscriminate. While they may clear bacteria, they also kill off the viable fibroblasts and keratinocytes that are required for tissue repair. A second failure occurs when patients apply heavy, occlusive ointments. These trap heat within the traumatized tissue, which can trigger acute reactions like persistent swelling, hypersensitivity, or the formation of milia. Traditional care often conflicts with the body's natural healing mechanisms. Without proper management, a controlled injury can quickly evolve into an avoidable clinical complication. Improving outcomes requires a shift away from temporary irrigation and toward the sustained control of the tissue environment. As this illustration shows, standard saline irrigation provides only a temporary wash. To be effective, a solution needs to maintain prolonged contact with the wound bed. A hypertonic, hydrogel-like solution can be applied as an immediate breathable liquid dressing. It sits atop the disrupted barrier to continuously regulate fluid dynamics and moisture levels. This approach focuses on the active maintenance of the physiological conditions required for tissue remodeling, providing the stability that simple, transient cleaning cannot. There are 4 biological pillars required for optimal remodeling after an aesthetic injury. The first pillar is preserving cell viability. By utilizing non-cytotoxic cleansing, the formulation supports cellular function and clears debris without the tissue damage associated with harsh antiseptics. To control the microbial load, a low-dose 0.01% ionic silver preservative protects the vulnerable microchannels from subclinical infection during the critical healing window. The formulation also includes menthol to instantly calm heat sensations and reduce stinging. This regulates the expected physiological reaction without the need for heavy occlusion that can trap heat. Finally, a specialized buffering system and glycerol maintain homeostasis by matching the exact 7.4 pH of exposed tissue and regulating the moisture balance. This multi-component formulation replaces a complicated routine of multiple products with a single, precise biochemical environment. This timeline maps a continuous 3-phase framework that bridges the gap between the clinic and the patient's home recovery. In Phase 1, we optimize the cellular canvas before the procedure begins by reducing surface debris and the microbial load. Phase 2 covers the critical 72 hours immediately following the procedure. The focus here is protecting the newly disrupted barrier and managing acute inflammation through non-traumatic cleansing. During Phase 3, which lasts from days to weeks, maintaining a stable, moist environment drives balanced cellular proliferation and complication-free remodeling. Using one continuous protocol from the clinic to the home removes clinical variability and ensures a highly predictable healing response. When the microenvironment is perfectly maintained, we can observe tissue fibers seamlessly weaving back together, supported by healthy granulation and the regeneration of blood vessels. Careful regulation of the extracellular matrix and collagen organization during this window directly determines the final quality of the skin's visible texture. By facilitating proper scar maturation and reducing destructive enzymes, the newly formed tissue gains the strength and elasticity required for a resilient result. Aesthetic success is not achieved through the trauma of the procedure alone. It is defined by the biological environment in which the skin recovers.